Vaughn, what I wanted to ask you right now was about my nickname, what my friends have called me when I go to different events and seminars and I start talking about omega-3s, and they call me the omega-3 man. That's kind of the nickname that I picked up. And I really attribute my ability to actually regain control of my heart health was because of omega-3s. And my problem was triglycerides were really high. And then there's some other factors, but I wanted you to just give me sort of a broad overview. The postmodern American man, woman, 40, 50, 55 years old. What is the greatest concern for avoiding sudden death, heart attacks, avoiding strokes? What do we need to look for in lifestyle, in nutrition, all that sort of thing?
Absolutely. Well, I don't know if there is one great concern. I think there are different concerns for different people, but it doesn't have to be so complex that you can't possibly conceive of all the variables. The first thing I don't think most people realize is that heart disease is mostly what's called a disease of civilization. It's something that afflicts Westerners and afflicts Americans at a very high rate, and doesn't tend to afflict people in less developed countries, even those who live as long or longer than we do. So I think the average perception, even amongst many doctors who inquire into this issue, is that heart disease is a natural part of aging, and we have more of it in America because we live longer. And yet you can look all around the globe and find a lot of very healthy cultures with average lifespans longer than ours with very little heart disease. So this has been well known for decades, and a lot of people have asked the question and attempted to isolate one or two or three variables that are sort of why you find so many hunter-gatherer and so many primitive farming populations with such low incidences of heart disease. And people have looked at their increased activity levels, and there's certainly that. The more you exercise, the healthier your heart is. A lot of people have looked at diet, and diet is a huge factor. So we could look at a lot of individual variables in diet, but the one consistent theme, of course, is that these pre-modern cultures with very good heart health don't consume processed foods. There's no trans fats, not even available. There aren't junky commercial oils full of omega-6s, but there's also no sugar, there's no refined flour, there's no processed carbohydrates, and those processed carbohydrates create a tremendous amount of inflammation, and that inflammation invariably creates poor heart health. And also, excess consumption of processed carbohydrates leads to much higher levels of triglycerides. That stuff gets turned into circulating fat, and that's really all triglycerides are, is circulating fat. And as well, it stresses your system out, and the more stressed you are, the more cholesterol you produce. And nutritional stress is a very real phenomenon. There's very little that stresses the human body as much as processed refined carbohydrates. So white sugar, white flour, pasta, baked goods, crackers, snack chips, all those kinds of foods, they are stressful to the heart. They're fine in strict moderation. I always like to make the analogy, you want to consume them the same way you would consume scotch, or the same way you would consume a martini. Every once in a while for recreation, that's it. Get that it's not good for you.
Right.
It's a huge factor, and it's a factor that doesn't receive enough attention. Probably the other factor that doesn't receive enough attention is the entire phenomenon of mind-body health. And the more psychological stress you're under, the worse it is for your heart. It's not that the medical community isn't aware of that. They're very aware of it. It's just there's not much focus on that because how you change that is a little amorphous. You can know you're stressed. What do you ultimately do about it? But the thing is, when it comes to the mental and emotional side of our nature, there's just as much of a sort of anatomy and physiology of the psyche as there is of the physical body. And as you start to understand the psyche better and better, you can work with it the same way you work with the physical body. So what I do with people who have heart health concerns, I always try to break down the major variables. The major variables are diet, movement, stress, and then the one I haven't talked about is sleep. And if you don't sleep well and you don't sleep through the night, also very taxing to the heart. So getting to bed on time, having a dark, calm, quiet sleep environment, very important. And if you snore or have breathing difficulties, very taxing to the heart, and that's something to talk to a doctor about.
Okay, so repeat those four things again.
Absolutely. One way I like to break it down is to say you want to be healthy, remember your meds. And meds is MEDS, which stands for mind state, exercise, diet, sleep. Those are like the core four elements in heart health and actually in health generally. So mind state is what are your stress levels like? What's your general thinking about yourself and your life? Exercise is, of course, your movement patterns, and there's a way to move that will really help heart health more than other ways. There's a separate video on that which we can definitely attach and point people towards. Diet is, of course, how are you eating? And the simple take-home rule with diet is no processed carbohydrates, no trans fats, saturated fats in moderation, good general simple principles. And then sleep, you really do need to get between 7 and 9 hours of sleep most nights of the week and be getting to bed at a reasonable hour. 11 is great, midnight is beginning to stretch it, 1 in the morning you can get away with. and then sleeping 7 to 9 hours consistently. And if you're not doing that, it's always taxing for the heart. So mind state, exercise, diet, sleep, meds.
So live right, eat right, exercise right, and sleep right.
Yeah, think right.
Think right.
Think right, eat right, exercise right, sleep
Great.
right. Yeah.